generally the state of the health in Malawi is can improve. But with the Millennium Development Goals, we made some progress, and on two of those that related to health, reducing child mortality, as well as combating HIV and AIDS, malaria, and other diseases, we made quite some good progress. However, that progress can easily slide backwards because of the general status of the healthcare delivery system, but also the investment that goes into it. So when we get partners like the Gorey-Malawi Health Partnership, we get excited, and we like to do more before they go away at some point. We don't want you to go away, Joe. This is from the Ministry of Health strategic plan itself. While Malawi continues to struggle with reducing its communicable disease burden, it is now faced with growth in non-communicable diseases. So that's where the partnership comes in very handy. So we have PAMS, GP surgery. On one side, we have Mzuzu Central Hospital, which is a government hospital, and then St. John's Hospital, which belongs to the Catholic Church in Mzuzu Diocese up north of the country. So very desirous to helping Malawi manage the burden of NCD. Very good work has begun at one government facility, as I indicated, but also at one Christian-based facility, that's St. John's, where I'm very much involved with. Fruits are beginning to bear, and I'll talk a little bit later in the presentation. Some of the work that we have done with the partnership, so we have signed the MOUs, both with the Central Hospital as well as for St. John's. Steering committees have been developed and instituted, and the 3 clinical fellow posts in NCD have been instituted. Quality improvement workshops have been completed. A very solid curriculum on chronic respiratory illness has been completed. A little bit of capacity building also. We have a Master of Science by Master Chisale in that's at University College Dublin. Mary Swande is studying a PhD on NCD management, and also a lot of web conferences and using WhatsApp to continue mentoring. And we see results. Maybe scientifically we need to examine them more, but we can see it and we can feel it, we can touch it, that there is improvement going on here. So diagnosis levels have improved, but also drug availability, particularly beclomethasone, because it's both preventive and remedial. Treatment quality has also improved, so much that numbers of repeat or frequent visits to the hospital for asthma have gone down. Hypertension has also been included in the interventions, and you can see the appreciation that people are having. And staff feel very supported. If they were here to testify, you would hear it from them. And here's just an example of how a staff member feels supported. So Joe, Peter, the other side, and he's giving them information of cases that he goes through, and they get instant support from the colleagues this side. Quite helpful. Challenges now, or teething issues that maybe the partnership needs to, do we include diabetes? Do we begin on it? Inadequate awareness of free treatment for asthma and probably hypertension. But do you go out and tell people that we can do this? Do you get overwhelmed and then you back down on quality? Could Mzuzu become a center of excellence leading the way in NCD management in Malawi, in Africa? We definitely think so. Could we cope? We think so, that side. The way we see it, we're in a better position as a hospital and as a diocese to respond to the trend in NCDs. We need to strengthen the current interventions and also scale up and include more NCDs. We have 3 more hospitals within the diocese and 5 in our sister diocese up the country. Could St. John's be a model? We definitely think we could be. We cannot afford to go backwards from before the partnership. We can't, because diagnosis was solely based on good history taking and medical acumen. Drug availability was not guaranteed. People could have died in the process. So we can't afford to go back to a situation like this. We are also looking at more capacity building for today and tomorrow, so training and system strengthening, treatment, so medical and nursing acumen, but also sustainability. I think there was a lot of talk, has been a lot of talk on sustainability today. Social cultural interventions, the portion sizes in the plate. It's very social cultural in Malawi. Some wise sayings here. Peter took a lot of time to teach me the Irish. Ninat guka lekela. So there's no strength without working together. In Chichewa, se mutu mozi susenza denga. So that roof there, no one head can actually lift it. We need a joint effort, so one head can't carry the roof. Mumoza muni kongono. There's power in unity. From the way we see it, we're going to get wedded to Gorey-Malawi Health Partnership without an option of divorce.